There's over 1 million sports-related concussions that happen every year in the United States. The American Academy of Neurology is pleased to be able to release this evidence-based guideline for the assessment and management of sports concussion. This guideline is going to replace the 1997 American Academy of Neurology guideline, and it was developed using an evidence-based medicine process and was multidisciplinary in nature, including neurologists, but also a majority of committee members were from other specialties who are involved in the care and assessment of athletes with sports concussion. These recommendations are a best summation of the available science regarding the assessment and management of sports concussions. To develop this, our group put in thousands of hours and reviewed thousands of abstracts and hundreds of papers to cull out the best evidence that could then drive clinical practice. As part of this process, 2 authors independently reviewed each critical piece of evidence and came to agreement on the quality of the evidence, and an anonymous survey method was used for the different committee members to develop the recommendations and the practice recommendations. Perhaps one of the most important recommendations from this guideline is that an athlete who sustains or is suspected of sustaining a concussion should be removed from play that day and then be assessed by a licensed healthcare provider with expertise in management of concussion. Another important component that came out of the evidence was the effect of concussions on youth. And the evidence suggests that high school individuals with concussion take longer to recover than their collegiate or professional counterparts, and so that they should be managed more conservatively. The guideline also found that there was a dearth of evidence under the age of high school, and so this was an area for future investigation. While an athlete should be removed from contact risk activity after concussion, the evidence is really sparse for complete cognitive restriction after concussion, complete cognitive rest. And the guideline recommends that athletes be removed from sports activities that would put them back at contact risk. An important distinction of this guideline from the 97 guidelines is that we've moved away from the grading system of concussion. We don't find that the evidence supports trying to rate a concussion at the moment of impact and determine how severe it was or how long the return should play would be. In this case, the assessment of concussions is done individually with multiple diagnostic tools, and the management plans are individualized because there are different factors that contribute to how long an athlete might recover from concussion. I'm going to turn it over now to Dr. Kutcher, who can give you some more information.
I think and one of the things that I want to emphasize first is with this kind of approach, looking at all the evidence, that there's not a diagnostic tool that is supported in the literature as being something that can diagnose the injury or diagnose when the injury is over. And so essentially it is a clinical diagnosis, and if there's a doubt, you sit the person out. And that's, I think, one of the main messages that we want to get across. We did look at several studies that had concussion rates and risks and how often certain athletes get concussed. One caveat, not every sport has been studied. Not every sport has good data to look at. But among those, the concussion risk was greatest in American football and rugby on the male side, followed by hockey and soccer. On the female side of things, it seemed that soccer and basketball were the sports that had the higher rates, again, for those studies, those sports that were studied or in the literature. We did also find that an athlete who has a history of 1 or more concussions is at greater risk for being diagnosed with another concussion. And that's a distinction, I think, between being diagnosed with concussion and being injured again. But still, I think there's evidence that, we found that there was evidence that previous concussion does give you a higher risk of having another one. The first 10 days after a concussion is a key time where there seems to be a higher risk for worse injury. And so that's on average across data that we found published. And so that's an important finding of the guideline. Another big issue that is in the media and has been talked about a lot are helmets. Are they good enough? Can they be better? Right now, the evidence speaks to helmets being able to provide some concussion reduction of risk for sure, but that there's no one helmet type, manufacturer, or model that has been shown to be superior to another. Another aspect of what we looked at was was there evidence of who should clear athletes to be deemed safe to go back to play. And essentially, we looked at, licensed healthcare providers is the term that best describes, I think, that person. These people should look for ongoing symptoms, especially those of cognitive dysfunction and headache, other things that are common with concussion. And especially in the younger age group, those things tend to be linked to a longer injury. Finally, I'll turn it back over to Dr. Giza. We looked at a lot of studies that involved chronic brain function, effects over time, and that's a hot topic, obviously. There is some data to support the concept that in professional athletes, there is a risk of long-term cognitive impairment. The literature does not support whether this is chronic traumatic encephalopathy or not. That has not been investigated to a substantial degree to be able to make that kind of description. But a chronic cognitive impairment seems to be something that can happen with professional athletes, but that group only. There's no data published that speaks to the other levels of sport. I'll turn it back over to Dr. Giza.
So just to, again, re-emphasize, there is no single test that is a litmus test for concussion. Okay? There are many diagnostic tests that can be helpful, but concussion is essentially a clinical diagnosis that is best made by a clinician with experience and training in concussion. I think one way to think of this is it takes a village to properly manage concussion, and multidisciplinary collaboration is important. Another important point is the kids aren't just little adults, and there's additional research that may be necessary, but certainly the findings of the guideline suggest that there are differences in younger children, how they might recover from concussion. The typical signs and symptoms of concussion that people should be familiar with include headache, sensitivity to light, dizziness, noise sensitivity, nausea, vomiting, changes in memory, judgment, or disorientation. Loss of consciousness can occur with concussion, but it's not essential. 90% of concussions occur without a loss of consciousness. And it's important for the general public, medical providers, as well as coaches and parents, team members, to be able to recognize the signs of a suspected concussion so that when a concussion is suspected, that individual can be sat out. So for more information about these guidelines and resources, the American Academy of Neurology Sports Concussion Toolkit is available at AAN.com/concussion. The Academy is also releasing a new app today called the Concussion Quick Check to quickly help coaches, trainers, and parents recognize signs of concussion from the sideline. The Concussion Quick Check app can be downloaded at app stores or AAN.com/concussion.